Hello everyone. Today we are going to discuss pusher syndrome, or simply a posture that is seen in a few people who have had a stroke to tend to tilt towards the weak side. In this case, the good side, or what we call as the stronger side, tries to push towards the weak side because it does not realize that the posture of the body, the midline orientation of the body is accurate. This tilt is approximately seen to about 20 degrees, and the automatic correction of the posture is missing in this case. This pusher syndrome is observed to go away after about 6 months of the stroke, but that makes us lose 6 months of recovery or delays the recovery, especially the motor recovery, by 6 months, because it will not only affect your walking ability but also your standing, sitting, even a general movement in space. So body orientation in space needs to be corrected. This pusher syndrome is observed in people who have had usually a lesion in a part of the brain known as the thalamus, and it's usually associated that the body has some kind of neglect towards the weak side and it does not realize that it is pushing towards that side. For example, the left side is affected, so the left hand, left trunk, left leg, even the left side of the space is affected. A very, very bad idea to correct pusher syndrome is when you try to tell the patient to push towards the stronger side, because it is going to resist. There is no vertical orientation by the person, so they will never know that they are tilting. 8 very simple techniques by which it can be corrected at an initial stage is reaching activities towards the stronger side. So in that case, without any resistance, the person will try to lean towards the stronger side and correct their posture. The reference of a mirror is very important. Please check out my video on mirror therapy and how helpful it is in correcting posture and overall improving the balance of the body, so that mirror can help you give a visual feedback whether you are upright or not. Any kind of vertical stick or objects can be used to guide this correction, so that the person has to say that you should be able to look at that stick in the center and you should not go towards its left or right, and it can also be incorporated with a mirror. Wall support is a very good way for self-correction, because if there is a wall support that is kept towards the stronger side, then the person will have a reference that they have to keep touching that wall and their posture will automatically be corrected. A pelvic wedge that is provided in sitting position can really help, because it will help to tilt the body towards the stronger side. So the wedge has to be provided towards the weaker side. Weight bearing and weight shifting activities are very good. So in sitting, maybe on a chair with armrests or even lying on your tummy, weight shift towards the good side and the weak side can be practiced. Similarly, weight bearing exercises where the weak leg takes the support alternated by the strong leg can also be practiced. Lying towards the stronger side automatically provides a postural correction, because then the body does not have anywhere to push the weak side of the body towards. If the person is lying on their tummy and they're allowed to fall down, then they have to correct themselves. So for example, they take weight towards the good side and they fall back, then they have to come back and align themselves, and again a mirror can be used over here for postural correction. These kind of postural strategies can really help to improve the posture of the person in general, correct if the person has developed pusher syndrome, and will eventually lead to motor recovery in the person. Neuroplasticity is actually the basis of all of this. Please allow neuroplasticity, or allow your brain to correct itself by beginning the rehab as early as possible, and which also means correcting pusher syndrome in time. Let me know how informative this video was. Mention in the comments below. Like and subscribe the channel. Tell me any other video suggestions that you may have, and we'll meet again soon.